my name is Hidayah and today my topic will include checking capillary refill and using a pulse oximeter. Capillary refill test, or also known as blanching test, is used to assess the blood flow through peripheral tissues. It also measures the efficacy of the vascular system of hands and feet as they are far from the heart. This method is a quick and cheap way to indicate decreased peripheral perfusion and may indicate cardiovascular or respiratory dysfunction. So the test is really simple. All you have to do is apply pressure on the tip of your finger. It could be done on your toes too, but I'm using my hand. Apply pressure to the tip of your finger for at least 5 seconds. Release it when it turns pale. So 1, 2, 3, 4, 5, release it, and you will count how long it takes for the color to turn back to pink. If it's less than 2 seconds, that means it is normal, but if it's more than 3 seconds, abnormal result, it may be an indication of dehydration, hypothermia, low blood pressure, peripheral vascular disease, or shock. Next, I'm going to talk about pulse oximeter. Pulse oximeter is a device that measures the oxygen saturation level of blood, and this level shows how efficiently blood is carrying oxygen to the extremities furthest from your heart. They are used extensively in perioperative period and might improve patients' outcome by enabling early diagnosis and correction of perioperative events that might cause complications or even death. For example, hypoxemia is when the level of oxygen in the blood falls below the optimal levels. It's a risk during surgery when patient breathing and ventilation may be affected by anesthesia or other drugs. So, medical staff often monitor patients during and after surgery using pulse oximeter. There's 3 types of oximeter that I know of. The first one is what you call handheld oximeter. They're slightly on the expensive side, so this is what you generally see used in hospitals or clinics. The pros of using this is that the probes can be changed depending on who uses it, so it can be used for children, adults, and even infants. The second one is the fetal pulse oximetry, used specifically for measuring the oxygen saturation of hemoglobin in fetal blood. And the last one is what we are all familiar with, which is called the fingertip pulse oximeter. You can use this on children and adults, but not on infants. Before I demonstrate on how to use this, let's familiarize ourselves with how oximeter works. The sensors detect how much oxygen is in your blood based by the way infrared and red light passes through your finger. So from this, we can say that the oximeter reading can be affected by multiple factors such as skin pigmentation, skin thickness, skin temperature, fingernail polish, and pore circulation. So this is a pulse oximeter. This is what it looks like. To turn it on, you push this button and it will show you the oxygen saturation level, the pulse rate, and the perfusion index. But before you take the measurement, you want to make sure that your hand is free from any jewelry. There is no nail polish on the finger that you're going to put the oximeter on. Your hand should be warm. I'm in a room temperature currently. And that you have rested well for 5 minutes. This is to ensure accuracy in reading. But another thing that could affect the accuracy is deep skin pigmentation. So if you are darker skin, you may have inaccurate reading of pulse oximeter due to its mechanism. So I'm going to test this on myself because I don't have a patient today. I'm going to turn it on and put your index finger inside all the way through. And when it's taking a reading, you want to make sure your hand is flat on a surface and you are in a sitting position. You want to keep this position for 1 minute without moving to get the final reading. As you can see here, my oxygen saturation level is 99. Which is pretty normal. If it's from 95 to 100, you're good to go, you're normal. But if it's 90 and below, you might want to get it checked immediately because it is a sign of hypoxemia. And hypoxemia is related to breathing or circulation problem. It may result in symptoms such as shortness of breath. And because pulse oximeter is not 100% accurate, you will have to record at least 3 times a day to keep yourself monitored throughout the day.